Hey there, and welcome. Speaking directly to you as a clinical expert from the American Wellness Center here in Dubai, I really want to guide you through a topic that is, quite frankly, profoundly misunderstood yet so incredibly common. Today, we're going to explore how getting a proper adult ADHD assessment isn't just about slapping a label on you. No, it's really about moving from merely surviving your daily life to actually truly thriving in it. So let's jump right in. Have you spent years feeling totally overwhelmed or just constantly disorganized without really knowing why? If you're nodding your head right now, listen. I want you to know that your hidden daily struggles are completely valid. In our experience at the American Wellness Center, we constantly, and I mean constantly, see highly capable adults battling chronic stress and emotional overwhelm in absolute silence. You know the feeling, right? You look completely put together on the outside, but internally you're paddling as fast as you can just to keep your head above water. Okay, let's dive into this. The common experiences we see with the patients we support, well, they go way beyond simply losing your keys. We're talking about persistent, real struggles with focus and actually getting tasks across the finish line. Chronic procrastination that literally feels paralyzing. A deep sense of overwhelm from just normal everyday routines, and a massive difficulty in managing emotions or prioritizing what actually needs to get done. These symptoms quietly disrupt the work, the relationships, and the overall well-being of the brilliant professionals, dedicated students, and loving parents we see in our clinic every single day. Lots of them strongly suspect they have undiagnosed ADHD, but, well, they've just never had a truly safe space to explore it. But here is the absolute most important takeaway for you today. You do not have to navigate this alone, not at all. At the American Wellness Center, we have this amazing, dynamic team of over 60 Western-trained clinicians representing a diverse array of over 20 specialties. It's basically an entire village of experts ready and waiting to serve as your guide. When you walk through our doors, you're backed by a whole multidisciplinary team completely dedicated to figuring out exactly how your unique brain works. And you know, our roots here are deeply established. Since we opened our doors back in 2016, right in the heart of Dubai Healthcare City, our team has successfully supported literally thousands of patients of all ages. We combine some really advanced psychological tools with a culturally sensitive understanding of what it actually means to live, work, and raise a family as an expat or professional right here in the UAE. We've built a trusted home for evidence-based, truly compassionate care, and we bring every bit of that experience into every single assessment we do. So how do we actually figure out what's going on underneath it all? Let's move into section 1, beyond the surface, what we actually evaluate. A proper assessment isn't just checking some boxes on a quick survey. It's a deep, thorough exploration of both the cognitive and emotional sides of how your symptoms actually show up at work, at home, and in your social life. And to really understand ADHD, we have to look very closely at executive functioning. Think of executive functioning as the CEO of your brain. It's a set of cognitive processes responsible for planning, organization, decision-making, and memory. When we evaluate our patients, this is a huge area of focus, mostly because it's something so many adults struggle with every single day without fully grasping what's happening. When your brain CEO is totally overwhelmed, man, even the simplest daily tasks can feel like climbing Mount Everest. Now, what's really interesting about this slide is just how comprehensive our evaluations really are. We don't just look at one tiny piece of the puzzle. We look at your attention and concentration, basically your ability to sustain focus. We evaluate your impulsivity and self-regulation, which is all about emotional and behavioral control. We look at your occupational or academic performance to spot patterns in your productivity, and absolutely crucially, we look at your personal history and context. We want to capture the whole picture of your life, from early childhood stuff right up to your current daily stressors. But here's the thing, diagnosing ADHD isn't just about confirming ADHD. What we consistently see is that ADHD rarely travels alone. And that's exactly why we meticulously screen for coexisting conditions. We conduct what's called a differential diagnosis. We have to clearly distinguish ADHD from anxiety, depression, OCD, or even sleep disorders. You know, sometimes chronic stress masquerades as ADHD. Other times, it's the undiagnosed ADHD that's actually causing the severe anxiety. We ensure absolute accuracy so that we're treating the actual root cause and not just putting a Band-Aid on the symptoms. Which naturally brings us to the how. Let's transition over to section 2, the map to clarity, our evidence-based clinical approach. I completely understand that the whole idea of a psychological evaluation can sound pretty intimidating, but I want to reassure you right now that our assessment process is highly structured, scientifically rigorous, and specifically designed to ensure you are completely comfortable and everything is strictly confidential. We start with step 1, a comprehensive clinical interview where we honestly just sit down and listen to your story. Step 2 involves standardized ADHD testing tools that are validated specifically for adults. Then, in Step 3, we conduct a functional assessment of your attention and emotional regulation. Step 4 is that critical differential diagnosis we literally just talked about. And finally, Step 5 is the personalized feedback session. This is where we sit down together, explain exactly what the data is showing us, and map out your very next steps. The absolute core of our clinical philosophy at American Wellness Center really comes down to this. The goal is to give you more than just a diagnosis. It's about understanding how your mind works and exactly how to support it. Our compassionate evaluation is fully designed to empower you. We aren't here to just hand you a label and say, good luck, see you later. We are here to give you an actual instruction manual for your own unique brain. And that leads us to my absolute favorite part of this whole explainer, Section 3, the transformation, what you will gain. And this brilliantly illustrates exactly what we're talking about. Before the assessment, you're likely dealing with chronic overwhelm, confusion, constantly trying to mask your symptoms just to fit in, and completely drowning in unmanaged stress. But after the assessment, it's a whole new world. You receive a clear, comprehensive diagnostic report. You get personalized management strategies perfectly tailored to your life. You walk away feeling this incredibly deep sense of empowerment. It's the pure clarity of finally knowing that your challenges have a real name, that they absolutely aren't your fault, and that there is a clear, evidence-based path forward. So, how do we make sure that transformation actually sticks? Well, the main reason patients choose American Wellness Center is that we provide a completely integrated pathway right from day one. In the testing and diagnosis stage, our licensed psychologists and psychiatrists use the most advanced tools to give you real answers. Then, in the treatment strategy stage, we offer tailored medical follow-up and targeted therapy. And for daily management, our expert coaches step in to provide lifestyle guidance to help you actually implement these changes out there in the real world. You don't have to bounce around trying to piece your care together. We literally have the entire team right under one roof. It really all comes down to our ultimate commitment: to help you see your strengths, not just your struggles. You see, people with ADHD are so often incredibly creative, highly intuitive, and capable of this intense, amazing hyperfocus. Our foundational belief is that every single person deserves to truly thrive. We want to help you shift your focus from merely managing your perceived deficits to actually unlocking and leveraging your natural, incredible potential. So I'm going to leave you with this final, thought-provoking question. Are you ready to finally understand how your mind works and step right into your full potential? If the information in this explainer resonated with you today, remember that your very first, completely safe and informative consultation with us is simply a conversation. That's it, but it is the very first step toward making a real, effective change. You've spent way too much time just surviving. It's time to thrive. Thanks so much for joining me for this explainer today, and we honestly can't wait to support you on your journey.